Okay, let's get started. So, I am Dr. Odulak, and today I'm going to be teaching you a little bit more about the ins and outs of bloating. And I'm going to be giving you the functional digestive approach that I use in many of my patients that I see that are struggling with this very difficult and misunderstood symptom. So, let's get right into it. As I said, I'm Dr. Odulak. I am a board certified naturopathic doctor. I was trained at the Canadian College of Naturopathic Medicine in Toronto. I am now back home. I am treating New Yorkers and telemedicine patients at East Village Physical Medicine in New York, in the beautiful East Village. And I do not have any professional disclosures for this presentation. So, to give you a bit of an overview of what we're going to be discussing today, we are going to talk about why bloating is so common, the 6 root causes of bloating, symptoms to look for, how to approach each root cause pattern, and why digestive care must be individualized for you to get real results with your health. Let's dive right in. So bloating itself, it's not a condition, it's a symptom, but it's not just one issue. It's not just too much food. Now, food is the trigger, but it's not always the cause. Two people can have the same exact meal and have completely different reactions. I'm sure many of you have experienced this. You're out to dinner with a friend or a loved one, and you order the same meal or you share a dish, and you feel awful, but your friend seems to be totally fine. And so that tells you it's not the food. There's something different there going on, which is why it's so important to focus on physiology. What we see in so many patients who have been dealing with bloating for years, many times, is they've started to restrict the foods and the activities that they do because the symptom is so debilitating. What we need to do is not give them a restriction plan. We need to figure out exactly what's going on physiologically so we can get to the root cause and help them have a less restrictive, more free, more enjoyable life. So that's always my goal. So, root cause number one that I see very commonly in practice is a motility problem. So, when food is moving too slowly, it causes fermentation because it's sitting there for too long in the digestive tract, and that's causing gas, and then that causes bloating. So, lots of different things affect motility. One of the really common impacts that I see is actually stress and low parasympathetic tone. So, the way I like to explain the parasympathetic nervous system is when we hear that classic example, you're on a walk in the woods and you see a bear. Your heart starts beating, you start sweating, and you immediately go into fight or flight. Now, your body physiologically makes changes in this state to prepare itself for whatever it needs to do to survive. And now, the opposite of that fight or flight, kind of the opposite side of the coin, is rest and digest. And so when you're in rest and digest, your blood is flowing to all of your organs, your stomach acid is being stimulated, your enzymes are moving. And when you're in this stress state, all of that shuts down because your body's saving its resources. So motility is halted by high stress. So that's an important one to consider. We also see a low fiber consumption or low caloric consumption. In many cases, in patients who have been dealing with bloating for years, they have started restricting their calories for fear of the symptoms that eating evokes. And so that's often going to contribute to sometimes making the bloating worse because when you're not taking food in, your motility is not going to be stimulated. We also see motility problems in hypothyroidism. We see this in patients who are struggling with iron deficiency, post-infectious irritable bowel syndrome, and certain medications like GLP-1s as well. GLPs is, of course, a longer conversation. There are miraculous benefits, but one of the ways that GLPs do work are they halt your digestion. And so that can definitely cause bloating and a motility problem there. Now, moving on to symptoms that we see associated with motility bloating. Bloating that gets worse throughout the day, constipation or irregular bowel movements, that feeling of fullness very quickly after eating, and bloating after small meals. All of this kind of gives us the clue that it could be a motility problem. Now, the way that I usually determine the motility status of my patients is I use what's called a bowel transit time test. Now, this is a very simple take-home test that I give patients. Most commonly, I will suggest a cup of raw beets. I also have kind of a fun recipe for a blue food dye muffin that patients can try. And what I have the patients do is ingest the amount of food that we're recommending that's going to show up in the stool. So beets, that redness, blue, the blueness, and so on. Record when they eat the food, and then record the first time they see the color, and then the last time they see the color. And that tells us exactly how long it takes from when you eat the food until it's being excreted. And that tells us how long your transit time is, which gives us a bit of a hint into your motility. And so once we understand the motility is the problem, we have to identify why the motility is slow. We're going to approach someone with an iron deficiency very differently than someone who was on a GLP and is having motility problems. So with that, we're going to give some gentle motility supports in the form of nutrition and supplementation, give some nervous system support, especially if there is a motility association with stress, give some nutrient repletion, and of course, avoid one-size-fits-all laxatives, because with the one-size-fits-all, we're not actually getting to why the bloating and the motility problem is happening. So it's kind of a band-aid, but it's not going to fix the problem. Now, another common problem I see is dysbiosis. Dysbiosis is kind of a fancy way of saying that the microbes in your gut are imbalanced. And when these microbes are imbalanced, we see a lot of fermentation, because a lot of these strains of either, often in the gut health world, we say the good bacteria versus the bad bacteria in our gut. It's a very simplistic way of thinking. It's really more about the balance of bacteria. However, if you have an overgrowth of bacteria that are gas prone and fermentating, that's going to give you some bloating, and that's going to cause dysbiosis. So that's kind of the way to think about it. With dysbiosis, there can be lots of causes. I would say the number one cause that I see in practice is antibiotic use. For some, it is that they had to go on antibiotics long-term recently and they've noticed it. And I would say for more patients, they had some sense of getting sick often as children in their past, or even currently, and they were on antibiotics often, and that kind of depleted their good bacteria, for lack of a better term. Another cause of dysbiosis, again, is high stress. We're learning more about that mind-gut connection. Infections, food poisoning, overuse of antimicrobials. This is an interesting one. I've seen some patients who, through no fault of their own, have read something, for example, about the power of oil of oregano. Now, I love oil of oregano. It's a beautiful herbal antimicrobial. However, it needs to be used short term. And sometimes patients will use it for months at a time, and they kind of wipe out all of the good bacteria, and now the balance is messed with. And so that's one that we see as well, similar to antibiotics. And then again, low fiber diet here. Fiber is what feeds the beautiful bacteria in your gut. So if you're not eating enough fiber, it stops those good bacteria from surviving, and then we end up with dysbiosis. Now, symptoms of dysbiosis: bloating shortly after meals, excess gas is a big one, IBS type symptoms. So here we're thinking irritable bowel syndrome, constipation, diarrhea, maybe alternating with the two, changes in the stool, and then other dysbiosis like oral or vaginal symptoms. So, we have the gut microbiome, but we also have an oral microbiome, we have a vaginal microbiome. And so sometimes we'll see, especially in these patients who have used antibiotics long-term, is we'll see things like oral thrush or proneness to UTIs or some vaginal symptoms. And that always kind of perks my ears up, because it tells me that there's dysbiosis systemically that needs to be addressed. And then we have to think about, how do we determine this, right? So number one thing, which is just a thing of beauty, is we have dysbiosis tests. So we can look at the gut microbiome, we can look at the oral microbiome, the vaginal microbiome, and all of these tests that we take, they're functional. So you'll give a stool sample, a saliva sample, a secretion sample, and then this company will run the sample in the lab, and then they come back to us with a report that tells us exactly what is going on in the body, whether it's an overgrowth, an overabundance of something that needs to be lowered, or something is not even. And then specifically, then we can choose probiotics or antimicrobials that are researched best to deal with the strains that are overgrown. So I love this gut microbiome assessment. I use it in many of my patients, and it's been really effective to get symptomatic relief and root cause relief with bloating. So again, our clinical approach, we need to identify the microbiome parameters. We need to know exactly what's going on in the microbiota so we can restore balance with prebiotics, probiotics, antimicrobials. And then again, a big part is planning for that acute state. What happens when the patient eventually may need to go on antibiotics, or they have a virus and they are dealing with this dysbiosis again? So how can we strengthen the microbiome, not only now, but in the future as well? And what's our plan to replenish the balance that we need when there are eventual antibiotic use? So that's an important consideration there. Another root cause, low stomach acid. So if stomach acid is low, this is going to cause the food not to be broken down. Now we see fermentation and bloating. You're probably sensing a bit of a pattern here. Causes of low stomach acid, again, this stress, this being in fight or flight, your stomach blood flow stops and the cells in your stomach stop producing the stomach acid, and then you get bloated. Another thing often that we see with low stomach acid is actually aging. As the body ages, the cells in the stomach stop producing as much stomach acid, so often this needs to be supplemented. We also see low stomach acid in patients that have been on long-term acid reducers, and this is a bit of a tricky conversation. I always tell patients we can't vilify pharmaceuticals. We cannot vilify PPIs, proton pump inhibitors like omeprazole. They're amazing drugs and they absolutely have their place. However, if a patient is on a proton pump inhibitor long-term and then they're potentially ready to get off of it because their condition has improved, often their body has low stomach acid. And then, here we are in this situation. So it's definitely something that needs to be addressed and navigated at the source. We also see low stomach acid with certain deficiencies like zinc, and also with the gastrointestinal H. pylori infection can cause low stomach acid. Now, symptoms here, we're seeing bloating shortly after protein, feeling full after small meals, burping, and reflux. With the bloating shortly after protein, it's telling me that, okay, they're eating something and then their body is struggling to break it down. That tells me that it could be a stomach acid problem. Same with the feeling full after small meals. Now, reflux is interesting. Often patients will come to me with acid reflux or a GERD diagnosis. And we tend to think that reflux is high stomach acid that's coming up in our throat. And now, sometimes that is the case. However, reflux can also be a sign of low stomach acid. It feels counterintuitive, but it's just the way the body works. And so we need to determine where the stomach acid is at, even if reflux is the case. Also, undigested food in the stool or B12 or iron deficiency. B12 iron deficiency, this is telling me that there's some sort of malabsorption, that something is not being broken down, possibly. Of course, we have to look at diet and make sure that those levels are optimized. Sometimes we'll give patients a B12 or an iron supplement and they'll still have a deficiency, and that tells me there's a breakdown issue. So how do we determine low HCl? This is another take-home test. Has to be done under the supervision of a physician. However, I'll explain kind of how it works. So we have this beautiful supplement called betaine that has HCl, which is stomach acid, in it. And what we do is we have patients take these capsules in certain timing, and after each one record if they have any sensation in their chest. And so if a patient takes one capsule and immediately has that sensation, that tells me they have enough stomach acid. Now, I'll have some patients that will get up to 6, 7, 8, 9, sometimes 10 capsules with no sensation. That's telling me their stomach acid is so low, even supplementing them with that amount is giving them no reaction. So it's kind of a funky, very helpful and kind of logical once you understand it way to determine stomach acid level. So once we've made the determination that it is a low stomach acid problem, we need to address contributing factors. What is causing this low stomach acid? And then we give targeted HCl and enzymatic support. Again, this is very case dependent. We also have a wonderful tool in herbal medicine called demulcents. Now, these are a class of herbs that have basically phyto compounds that when you take them, coat the esophagus. And so while this is not a root cause solution, it is an amazing tool to help patients get immediate relief while we're working on addressing those underlying causes. So I'll often use a demulcent with a low HCl or high HCl case. And again, we want to identify the cause rather than suppressing the symptoms because we want to get true clarity and true relief. Moving on to our fourth root cause is stress and the nervous system. So again, digestion only works in rest and digest mode. You need this seesaw to be slid over to the rest and digest mode, especially when patients are eating. It's important to be in a calm, relaxed state, not running around, not working, being able to be present. So stress is going to reduce motility. It's going to reduce stomach acid, enzymatic output, and gut blood flow. It's incredible. When you're stressed, your stomach, the blood flow is not going. So all of these, you can see how impactful these are in a stressed out person. So again, symptoms for stress-driven bloating, we're looking here more actually at inconsistent bloating, symptoms that worsen with stress, IBS-like patterns, is bloating, constipation, diarrhea, not feeling great after eating, and then normal tests. So we'll see a normal microbiome or we'll get a microbiome, we'll optimize it, symptoms still remain. Normal HCl test, normal bowel transit, kind of ruling all these things out. So here it is a rule out. There's not one clear test, but it's kind of a clinical impression case. Clinically, we can approach this many different ways. Nervous system regulation. The vagus nerve is actually the nerve that turns on your rest and digest. So there's lots of different ways that we can stimulate the vagus nerve. We can practice mind-body digestive habits, slowing down when we're eating, all the things. I can go on forever about this topic. Optimizing mealtime habits and guided stress recovery. Okay, our last root cause that we're going to be discussing today is sluggish bile flow. So you may have heard of bile. It is made by the liver and stored in the gallbladder. And so bile's role is to emulsify fat so that digestive enzymes can break them down. So it kind of creates a little capsule over the fat, and then that allows the digestive enzymes to attack that fat and break it down. So if you have sluggish bile, you're going to have partially digested fats. Again, fermentation, reduced motility, gas, and bloating. It's all kind of the same pattern with a different underlying cause. And so causes of sluggish bile flow, you're looking at liver congestion, gallbladder sluggishness, a low-fat diet. Sometimes if we're not eating any fat, the bile is not being stimulated. Hormonal imbalance, high estrogen is cholestatic. So that actually means that it's going to stop the liver and gallbladder from making bile in a high estrogen state. Rapid weight loss, certain medications. Sometimes we can see this with GLPs, especially because it's that combination of rapid weight loss. So symptoms, here we're more looking at bloating after fats. If you recall, low HCl is bloating after protein. So this gives us a really good indication. Same thing with floating or greasy stools, pale or clay-colored stools. Sometimes patients tend to think that bile is a light color. And actually, if there is a healthy amount of bile in your stool should be that kind of chocolate brown color. So if we're seeing pale or clay-colored stools, it tells me that the bile is not quite making it to the stool. Nausea, constipation. Here, it's, again, more clinical impression. We can look at labs to look at liver function and gallbladder function, but oftentimes clinical impression, rule-outs is the basis here. And so our clinical approach to sluggish bile flow, address the root cause, support bile production and flow. We have wonderful herbs and nutraceuticals that help stimulate bile, bitters, lots of different things that we can do really effectively here. We also need to assess the diet composition and replenish fat-soluble vitamin deficiencies as needed, because if you're having a problem breaking down fats, you're likely not getting the fat-soluble vitamins like A, D, E, and K that you get with fats. And so that's definitely something that needs to be addressed. And then, of course, addressing gallbladder and liver function as needed. Not always in everyone, but it kind of depends on the patient. Okay, actually, our last root cause of the day that we're going to be discussing is food sensitivities. Now, food sensitivities are different from true allergies. They are often a delayed reaction. This will result in dysbiosis, enzyme gaps, poor digestion, increased intestinal permeability. And it's important to also remember true allergies, this is mediated by something called IgE, which is an immunoglobulin in the immune system. These are immediate, severe, very clear immune activation and require strict avoidance. So this is someone who's anaphylactic to peanuts. That's always my example. That's an IgE true allergy. Sensitivities, they're non-IgE mediated. So often these can be delayed hours, days, dose dependent, and can be related to digestion or environment. So here we may see a patient who can eat gluten in Europe, but then when they're here, they're sensitive and they have bloating, versus celiac would be a true allergy there. Symptoms, bloating, brain fog, fatigue, skin issues, changes in bowel movements. Here we're seeing more systemic problems. And then how to determine. Now we have a few tools for food sensitivities. Number one being the elimination diet, where basically you eliminate all of the common triggers for a certain amount of time, and then we slowly introduce them one at a time and see what the symptoms are like. This is actually the best and most precise way of understanding food sensitivities. We have food sensitivity testing, which I always give my patients the disclaimer. Food sensitivity testing, it's not like an allergy test. It's not a perfect system. It can give us an indication of what your immune system is reacting to, which can give us some guidance in patients who either don't have the time or the means to go through the full elimination diet, which is grueling. So often we'll start with a food sensitivity test. We'll look at the results, we'll eliminate those foods, and we'll kind of do a modified elimination diet. Clinical approach here is trial removal and system support. Sometimes just system support is enough. Reintroduction when appropriate once that gut is healed, and avoiding, of course, restrictive diets. So the big picture, bloating is not random. It has a cause, and sometimes it's a myriad of reasons. Sometimes it's 3 of or 4 of, or, and of all of the things that we've discussed today. So it's multimodal, but it's important to think about what is the cause, because there's always something. There's always an underlying factor. And it's important to focus on digestion as a system, and also think about the individual history, the family history, the physiology, and really look at evidence-driven root cause patterns and root cause treatments. And it's also important to remember everybody is different. Everybody's body is different. 2 people can be having the same exact symptom, but not the same cause. And so diagnostics really matter. And this is why treatment has to be individualized. It's not a one size fits all. We don't want to just block the cause. We need to figure out the cause, and we need to get to the root cause of that and address it as such so that you can have lasting relief. And often healing takes a layered approach. It's not a perfect system. It's trial and error. It requires a lot of communication between provider and patient. I tell all my patients, I'm sure those of you watching are sick of me saying this, but I have the medical education, but you are the expert on your body. And so it has to be a team effort. I want to give you options. You try them, you come back to me, and we kind of volley back and forth until we get some real progress. But often I'll see really great results initially because the root cause is being addressed. Thank you for joining me today on this webinar, whenever and wherever you are watching it. If you have any questions at all, feel free to send me an email. If you want to book a visit, you want to get into the bloating and kind of go through it and figure out what the cause is together and get you some treatment and get some relief, please feel free to book a visit. I offer 15-minute complimentary discovery calls where we can get to know each other and we can kind of make sure that we're a good fit. And as always, I'm just, sending lots of love to you wherever you are, whoever you are, and hoping you have good health and that you enjoyed this presentation. See you soon.